Hi, I'm Marc Sklar, the fertility expert. Have you been wondering how basal body temperature charting can improve your fertility and get you pregnant faster? Then watch this video to improve your fertility, get pregnant fast, and learn everything about basal body temperature charting. Leave your comments below so that we can answer them, and subscribe to our YouTube channel, The Fertility Expert. So now we're going to go over basal body temperature charting. You're going to see by the slides that progress in front of you what I'm discussing and what I'm referencing. Okay, some of the basics before we get into any of the slides, some of the basics of charting. First things first, basal body temperature charting is a resting temperature, which means you're taking it first thing in the morning. It was originally done and created for contraceptive purposes, to know when you were ovulating so that you didn't have intercourse. And then they realized that they can also use this for having intercourse and conception. And so we were also tracking other things as well to make that a little bit more effective. It's done first thing in the morning. So you wake up, the alarm goes off, you reach over, you grab the thermometer, it goes in your mouth, it beeps, you can get up and go about your day. Okay. If you forget, if the alarm goes off or you have to go to the bathroom and you get up and you go to the restroom, don't come back and take your temperature. It's done, because once you've started moving, your temperature will shift. So just skip it for that day. If this happens on occasion, it's not that big of a deal. Ideally, we'd like to have every day, but we're looking for trends. So if we miss a day, it's not that big of a deal. Hopefully, we're not missing the day right at ovulation. So that would be important to be able to see. So it's done first thing in the morning. If you wake, it also needs to be done roughly around the same time of day every day. So every morning. So if you wake up at 6 a.m. every morning, if it's done at 5:30 or 6:30, that's okay. But it shouldn't be done outside of that time frame. And that includes the weekend. So if you normally sleep in on the weekend, set your alarm, take your temperature, go back to sleep. Okay. If you wake up in the middle of the night to go to the restroom, which is common, the common question that gets asked to me is then, when do I take my temperature? Well, ideally we want you sleeping for at least 2 to 3 hours before you take your temperature. So if you wake up at 2 in the morning to go use the restroom, don't worry about it. But if you wake up at 5 and then you normally are going to wake up at 6, your alarm's going to go off at 6, just take it at 5. Okay? Those are the basics for it. I'm sure many of you will have plenty of questions. Feel free to ask, and we'll be happy to clarify. You can see by the slide in front of you now that this is a normal basal chart. We don't see these that often, or at least not this, perfect or normal. And that's because you wouldn't be coming to our office if you did have a perfect normal basal temperature chart. You'll see that the first half of your cycle, the follicular phase, as the follicles are growing and maturing, is a lower temperature. It's from about 97.2-ish to about 97.5 or 6. And that will maintain as a cooler temperature until you get closer to ovulation. Very rarely will you have a straight line across. You usually have some slight variation, about 1/10 or 2/10 of a degree up and down. That's completely normal. Everybody's normal in terms of temperature might also be a little bit different. Your normal temperature in the follicular phase might be 97.6 or 7 for that whole time. That's fine. We'll find what's normal for you. As you get closer to ovulation, or as you get close to ovulation or ovulation itself, your LH hormone, your luteinizing hormone, surges, and then you'll see a drop in your temperature. You'll see on this graph in front of you at day 14, it drops. Okay, that drop signals ovulation, and then after that, it rises. Okay, you're not ovulating at the rise, you're ovulating at that bottom point right where it says day 14 on this graph. The rise signifies that progesterone is now dominant. So in the first half, estrogen is dominant, it's a cooling hormone. In the second half, progesterone is dominant, it's a warming hormone. So your temperature should be warmer or hotter. Your temperature should rise. A normal shift or rise in your temperature should happen within 1 to 4 days. As it gets to that peak, it should cross over 98 degrees and stay above 98 degrees through that whole luteal phase, the second half of your cycle, until you are showing that you're pregnant or you're about to menstruate. In this graph, the temperature drops at day 28. That signifies that you're menstruating or about to menstruate. And if you were pregnant, you'd actually have another shift, a slight shift higher. You wouldn't have a temperature, but it might just go a shift higher and then maintain. Okay? Again, there's slight variations to the temperature, whether it's the first half or the second half of your cycle, and that's completely normal. And to reiterate, you're ovulating at the lowest point, not the highest point. So those are the basics of what a normal chart would look like. Some things that we don't go over in these graphs, so I'm going to use this chart as a means for that. If your temperatures in the follicular phase or the first half of your cycle are below 97 degrees consistently, and your temperatures the second half of your cycle are below 98 degrees consistently, one of the things to rule out is hypothyroidism. Okay, so that's oftentimes in the past how we used to diagnose thyroid issues. If in the first half of your cycle your temperatures are above 98 degrees, and in the second half of your temperatures of your cycle your temperatures are above 99 degrees or close to that, then the thing to rule out is hyperthyroidism. Okay, I've seen these pretty consistently in practice, and I've had patients who tell me, no, my thyroid's been checked, it's normal. We check it and it's not. This is very indicative of that, or can be, and so I'm just pointing that out as a rule of thumb. It's something for us to look at. If we go to the next slide, you'll see two slides here. We might even just be showing one slide. They're both the same. And these slides show stress and a compromised nervous system, or your adrenal glands are compromised in this case. What you see here is this erratic up and down or sawtooth nature to the chart. What this shows is stress. Now, it doesn't have to be for the whole chart. It could just be for 1 week, 1 week. Regardless of when it is or how it was, this shows stress. And pretty much we're going to go over with you, we're going to find out why you were stressed and what was going on, and we're going to try to correct that and change that, because we do not want that to replicate itself. That's not a healthy thing for us. Okay? The next slide shows lower temperatures. You can actually see that from day 1 to day 14 it looks relatively normal and healthy. I would actually be fine with this. But you'll see on the second half from day 14 through day 28, the temperatures are below 98 degrees. They take a long time to rise, about, 8 days or so, 9 days, and then they come right back down. That to me potentially shows a compromised or someone who's very cold, or low or insufficient progesterone levels. And then patients will tell me consistently that, I've had my progesterone levels checked and they were normal. Well, what does that mean? Most often I find that OBs will tell their patients to have their progesterone checked on day 21. Well, if you didn't, what the reality is that your progesterone needs to be checked 7 days after you ovulate. And if you didn't ovulate on day 14, then day 21 is the wrong day to have it checked. The second thing about this is that these blood tests are all a snapshot at a specific time and on a specific day and moment of your blood. It's not indicative or representative of what's always happening or what's always there. And then 2, your progesterone levels have a big range. The reference range is rather large. So you could be normal, but on the very low end, and they're still going to say you're normal. And that would show up here on your basal temperature. So if we see that consistently, then we're going to want to enhance or promote more progesterone production by the body. So the next slide here shows stress and heat. You can see that as after ovulation, the temperatures rise significantly, close to 99 degrees, and they're very up and down or sawtooth, as we saw here. So here we want to cool the body down and regulate stress. This next slide we don't typically see in the office, mainly because patients already come in with this, but this slide talks about if there's improper blood circulation or an obstruction of blood flow through the reproductive organs, then we would see that here. Okay, you see that second half of the cycle takes a very long time to get it to its peak above 98 degrees, and it comes right back down. That shows that blood circulation is hindered in some way, and it's usually due to some sort of obstruction, like a fibroid, a cyst, a mass, a polyp, endometriosis, something of that nature. Again, most patients already come in with those things, but on occasion we do find it because of this. This next slide goes over PCOS, or polycystic ovarian syndrome, and I won't go into depth about what PCOS is here, other than it's an anovulatory disorder. It's a disorder that where women don't ovulate regularly or at all, and when they are young, they might think this is a wonderful thing. I only ovulate and menstruate once a year, twice a year, 4 or 6 times a year, and they think that's a good thing. And typically they're just put on the pill and said, you know, you'll be fine. The reality is this is a much bigger issue and has a lot of potential for correction the earlier it's caught. But again, I won't go into depth about that. What this slide shows is that the patient's not ovulating at all. And the chart, you know, if I showed you the rest of this chart, it would just go on and on and on and on and on. So what we're going to do here, and what we do very successfully about 90% of the time, is regulate hormones, create a regular menstrual cycle, allow the patient to ovulate regularly, and then most of these patients should conceive naturally on their own. This slide, or the next slide, goes over premature ovarian failure. Or the other time you might see this is if you have high FSH, low AMH. I don't care for the title so much. I'm not a big fan of these titles. However, what this shows is that the first half of the cycle, the temperatures are sufficient. They're a good temperature itself, but you ovulate too early. So you're ovulating about day 9, and then the temperatures don't rise enough, and then they just go, and then they go down. So the second half of the cycle is long enough. It's the first half that is short here, and that needs to be corrected. And the reason for that is because the follicles are not maturing properly and they're immature. So even if you were to ovulate and have, and the sperm would make it to the egg, you really wouldn't have a healthy egg for implantation and for fertilization, because it's immature. So what we want to do here is not only move the ovulation day by about 3 days or so, but we also want to raise the second half, the luteal phase temperatures, to over 98. And we should see those things happen consecutively. So if we start to see this in basal temperatures, it starts to show us what to do. And this last slide shows a woman who doesn't ovulate at all. They're anovulatory, and it's specifically due to stress, because you can see that sawtooth nature again in this chart. So we're going to want to regulate stress and the nervous system, and if we can do that, this patient should actually start to ovulate regularly and have a regular cycle. Again, if you have any questions about your specific basal temperature chart, please let us know. There are plenty of apps to track your charts, and they're great because you can email them to people. It's easy for you to always have it for us to look at. You could print them out and so forth. One of our favorite ones is called Fertility Friend. They have a website that you can log in, and they have an app on your phone that you can use. But there's hundreds of these apps, so all of them are fine, whatever works best for you. Thanks for watching. Understanding basal body temperature charting is the first step for getting pregnant. If you want to learn about the different techniques you could be doing at home to get pregnant faster, watch the 3 videos to the right: tilted uterus, steam bath, and femoral artery massage. Don't forget to subscribe to the Fertility Expert YouTube channel for more tips on how to get pregnant fast.